Hi, welcome back to my channel. In this video, I'll be discussing about the anti-tubercular drugs. So first of all, you should understand that we have certain first-line drugs, and then we have second-line drugs, and then we have certain supplementary drugs. So starting from the first-line drugs, So in first-line drugs, we have HRZE. So it is isoniazid. Then we have rifampicin or rifampin. Then we have pyrazinamide. Then we have ethambutol. Now coming to second line. Now in second line we have para-aminosalicylic acid. Then we have thioacetazone, ethionamide, amikacin. Then we have bedaquiline. Then in supplementary, we have streptomycin and rifabutin. Now let's understand each drug one by one. So we'll start from isoniazid. Now isoniazid, basically it acts as a inhibitor of mycolic acid. So it inhibits cell wall formation. Okay, then it is basically a prodrug, and it is activated by catalase peroxidase enzyme. Now it acts both on intra plus extracellular microorganism. Now this is a question that they asked, that which is the only drug that acts only on the extracellular organism, and I'll tell you as we move on. Okay, so only on the intracellular. Okay, so first you have to remember for isoniazid that it acts on both. Okay, now another important point is that it has an important activity against rapidly multiplying bacteria. Now certain times there is a resistance to isoniazid, and it is due to CAT-G gene. And side effects are important in anti-tubercular drugs, so it causes cheese reaction. Then most important that you have to remember is peripheral neuritis. Now why? Because it causes the deficiency of B6, that is pyridoxine. So for prophylaxis you have to give 100 milligram per day, and if the deficiency develops otherwise in normal, then it's 10 milligram. Okay, so this is about isoniazid. Now coming on to rifampicin. Now rifampicin is the most preferred line of treatment. So first of all, basically mode of action is that it inhibits the DNA dependent RNA polymerase. Now it also acts on both extra plus intracellular bacilli. Then it is the only drug, this is important, this is the only drug that can be used against dormant bacilli. Now you have to know the side effects. So it causes orange colored urine. It also causes flu-like symptoms. Then it also causes the orange discoloration of contact lens. Okay, now it can be given safely in renal failure, and it is in pregnancy. However, it is hepatotoxic, so you have to remember this point. Then coming on to pyrazinamide, so I'll write it here. So we have third drug, which is Z, so pyrazinamide. So in pyrazinamide you have to know a lot of things. So first of all, it has the maximum sterilization action. It is effective in acidic media, so in inflammation. Then it acts on slowly replicating bacilli. Then it acts only on intracellular microorganisms. It also inhibits mycolic acid, and side effect is that it causes hyperuricemia. Okay, now let's get to the fourth drug, that is HRZE, ethambutol. Now this ethambutol, it basically inhibits arabinosyl transferase and synthetase. Transferase. Now here it is the only bacteriostatic. Rest all are bactericidal. Then it is distributed throughout the body except CSF. Then side effects is important. It causes optic neuritis or retrobulbar neuritis, green color. Now this is basically you have to remember, reversible and dose dependent. It is contraindicated in children below 6 years because they cannot tell as to what is happening to their eyes. Okay, and in this you have to remember certain points about bedaquiline. It is a recent drug. So for bedaquiline, you have to remember that basically it inhibits the mycobacterial ATP synthase, which causes decrease in the energy production of bacteria. Now, most important question that they ask is side effect of bedaquiline, which is QT prolongation. This was also asked in NEET, so you should know this. Now, there are certain categories of patient, and according to them, you basically treat the patients. Okay, so if I say there is a drug sensitive TB, so let's just understand the treatment aspect. So treatment. So if like there are patient categories. Now, if I say he is drug sensitive TB, he has drug sensitive TB. So either it is a new patient or any patient who has got treatment in less than 1 month. Okay. Then we have MDR TB. Now this is resistant to isoniazid and rifampin. Then we have rifampicin resistant. Then we have mono resistance. Now it is resistant to one of first line drugs except rifampin. Then we have polyresistant. In this we have a resistance to more than one first line drug except isoniazid and rifampicin. And then you have certain thing which is called as XDR TB. Now in this basically you have MDR resistance patient, that is isoniazid and rifampicin, plus he is resistant to fluoroquinolones plus any one second line injectable drug. Okay, now let's understand how we treat it. So if you have a new patient, so he's a drug sensitive patient, so in this new patient, so in this you have a 6-month therapy in which we give first we give 2 month to HRZE and plus we give 4 HRE. Okay, so it's a 6-month therapy. Then if you have MDR TB, now in this you divide the thing into a short course and a long course. Now how you decide whether you have to give short course or long course? If it's not a complicated case of TB or if it is not exposed to any second line TB drug yet. Okay, now in short course also the courses of 9 to 11 months and long is 18 to 20 months. Now in this you have to remember you have an intensive phase and a continuous phase. So intensive phase is 4 to 6 months and this is 5 months. Now here basically the drug that is mostly used is bedaquiline. Okay, so you have to remember bedaquiline. Now in this we give high dose of isoniazid, pyrazinamide, ethambutol, levofloxacin, clofazimine and ethionamide. In continuous, basically it is same as IP, but you are removing high dose of isoniazid and ethionamide. Okay, so you can write E, so ethionamide. Okay. Now in long course again you have certain groups. So you have like group A drugs, then group B drugs and then group C drugs. So you have to remember them. So to remember group A you have to remember LLB. So you have linezolid, then you have levofloxacin and then you have bedaquiline. Okay, now to remember B group you have to remember CC. So you have rifaximin, and cycloserine. Group C, you have ethanobutyl, pyrazinamide, then you have delamanid. Now this is delamanid is a very new drug. Okay, then you have imipenem. Okay, now in this what happens is you again have intensive phase and continuous phase. Now this is of 6 to 7 months and this is of 12 months. So what you do is first you basically give group A plus one drug from group B, then you change it, so then you will take group A, then some other drug from group B, SM. Okay, in continuous phase basically you stop the bedaquiline and you give a combination of LLC. Now what is LLC? LLC is basically linezolid, levofloxacin, and clofazimine. Okay, so this is about the treatment aspect of anti-TB drugs. Now if you have atypical mycobacteria, now this is also a question that they ask, so I'll write it here. Atypical mycobacteria. Now in atypical mycobacteria, basically we have prophylaxis of M-avium complex, so you give REC therapy. Now REC stands for rifabutin, then we have ethambutol and clarithromycin. Now this is basically given in patients whose CD4 count is less than 50 microliter. Okay. Now if you have a question that what is the difference between rifabutin and rifampin is, basically rifabutin is the one which you will prefer for MAC. It has a longer T half and it is it can also be given in patients of HIV. Okay. So this is mostly it. Then you can also remember certain points about streptomycin. It is contraindicated in pregnancy. Okay, now this acts only on extracellular, so only on intracellular was pyrazinamide and only extracellular is streptomycin. Okay, then it's basically yeah, after this streptomycin there is most of it is covered. So if you found this video helpful, do give it a like, share, subscribe. Thanks for watching.